Hello, good morning, and welcome everyone to County Executive Pittman's virtual press conference. This morning, the County Executive will provide updates on the school bus driver shortage, legislation from last night's council meeting, and the county's COVID response efforts. Today, we'll take questions at the end of those updates. As a reminder, please put your names and media affiliation in the chat, and I'll call on folks for questions in that order. And please keep your microphone and camera off unless you're called on to ask a question. Thank you, and with that, Mr. County Executive.
Thank you, Jeff, and thank you everybody for being here. I want to start out with my thoughts about the second day of drivers at bus company not being on the job. And we have 80 routes impacted. And I could read through all of the schools that we're talking about. I'm not sure that we have time for that. It's to say that I'm angry and upset is an understatement. And it's not the drivers that I'm angry at. The drivers are at wit's end at this point. We know that being a school bus driver is a grossly underpaid job that requires a huge amount of skill, responsibility, getting up before dawn to get these kids to school, working for 3 hours, then going home, then coming back in the afternoon and working for another 3 hours to get kids home from school, not getting home until fairly late in the evening to take care of their own families. And when you put their hours together, I've met with twice with most of the contractors of the bus companies that contract with Anne Arundel County Public Schools. And they estimate that in an average year, most of their drivers are making in the $25,000 to $28,000 range. Not enough to live on. And what they all say, and this is the consensus that I've gotten, not only from drivers, their employers, the companies, Anne Arundel County Public Schools and Dr. Arlato and his team, the governor I've spoken to about this, our Economic Development Corporation, our Workforce Development Corporation. There's a consensus that these jobs need to pay a livable wage, and that we won't solve the shortage of drivers problem in this county until we address the fact that these jobs don't pay a livable wage. And the stress of the shortage, like in any workplace when you're short-staffed, adds to it. So they're not able to take the vacation time. Sick leave is hard to come by. Benefits on these jobs are little to none. And the companies want to do better. The problem is that the companies have long-term, 12-year contracts. They bid on these contracts and low bid wins, and often. And that's the environment that government is often in when it does contracts. So I'm not criticizing the school system for the contracts that they have. But what we need now is a plan. And we've had enough meetings where we understand the problem well enough to propose the solution. And I have said that this is a number one priority for our administration. So whether we're looking at next year's budget or whether we're looking at our ARPA funds or whether we're looking at the $120 million of ARPA funds that Anne Arundel County Public Schools has that is to be used to bring kids back and adjust to the new economy post-COVID. There's a way to do this. And it's going to take upping some pay, and it's going to take changing the way some contracts are written, but it's doable and it has to be done fast. And what we need to do, and I'm calling on the school system to do this, and I will be down at the school board meeting at noon to call on the board to do this. I don't know whether I'll be able to be added to the agenda or not. I've let them know I'm coming, I hope to. But my message to them is that we must get a plan together, because it is that plan that is going to give our current drivers the faith that things will get better, to come back onto the job if they're striking right now, to stay on the job if they're not. But it is also, it's going to encourage others to apply for these jobs if they know that these jobs are going to pay a livable wage in the future. So it's time for a plan. I am ready to deliver on our end as the authority that funds the school system. The federal funds are there and available. The governor himself, when I raised this issue to him in a phone call, said, well, the schools all have federal funds that are to be used to bring students back to school. And if there's anything that would be appropriate use of that, it's increasing pay for these drivers because they don't get paid enough. So the work is clear for us. It's time to get moving. That's my message to the school board and the school administration. And I'm going to be meeting with drivers. They are not organized in unions, so there are no spokespeople that are designated and elected to speak for them. They may be working on that, I don't know. But I have asked any bus driver who wants to be heard to email me at countyexecutive@aacounty.org, and we will do a live streamed virtual meeting in which they can share what it's like to be a driver in this environment and what it would take to get more drivers and to keep them on their jobs. I think they need a voice, they need a forum, and we're going to provide that. That's Thursday morning at 10:30 a.m. and it'll be streamed on Facebook at County Executive's Facebook page. We do have a couple of other things that I want to mention and note before we move on, and I'm going to pass it on to Dr. Kalyana on COVID. But last night, the County Council voted 4-3, and I want to thank those who voted in favor of passing a prevailing wage bill in Anne Arundel County, so that, like most of our neighboring jurisdictions and like the state of Maryland, we will, starting with projects that have not yet been bid, construction projects with $250,000 or more of public funding, or $5 million or more of our funding if it's a non-public project, another entity that we're contributing to, must adhere to the prevailing wage requirements. And I was gratified to see so many out there supporting it. We had a rally before the council meeting. I particularly want to thank organized labor for being there, because this is not for organized labor. This is for all labor, so that it raises the wages in the construction trades for everyone, not just the union folks. So thank you to all of you for standing up for the whole industry and the whole workforce. I also want to note that last night, the council passed an emergency bill 7-0. Thank you to the whole council on this one, to extend our outdoor dining program for restaurants. The outdoor tents and outdoor seating that you see often in parking lots would not be allowed under county code due to parking requirements and others. And so we've extended it out into early 2023. And between now and then, we will be looking at our parking requirements and other things in our code to determine whether we can make that permanent forever. It's been great for the bottom line of those restaurants who have been hit so hard during COVID, and it's been healthy and fun for the customers. So thank you to the council for that. And then finally, I just want to, before I turn it over to Dr. Kalyana, who has some updates on COVID and where we stand, particularly in schools, that it really is unacceptable that so many children are being quarantined and kept out of school as a result of positive cases in the school. If they were all vaccinated, of course, fewer would need to quarantine, and ultimately fewer would be testing positive. I look forward to the decision. We're told that they will consider, Food and Drug Administration will consider the application for Pfizer 5 to 12 to authorize the vaccine so that younger kids can get it. And when they do, I believe it will take some time to get those smaller doses to our providers so that we can get them out, but we're prepared and ready to get those doses. Ultimately, my view, as I've said before, and I will always say and continue to say, is that that COVID should be added to the list of vaccines that our students are required to get to go to school. We have a system to do that. We know from a public health perspective, it makes all the sense in the world, and we need to protect our children. So with that, I will turn it over to Dr. Kalyana.
Thank you, County Executive. First, let's look at the data of where we are right now. And what we're seeing is that we've got our hospitalizations are just down a little bit into the 40s, which is good to see. Certainly, our case rate has been stable in the 17 to 20 per 100,000 range for more than a month now. We have seen a lot of deaths in the past month. We've seen over about 50 deaths during that time, and that's a consequence of the severity of the disease and the hospitalizations that we've been seeing. We continue to see that hospitalizations are much more likely in the unvaccinated, but even with continued spread, those who are vaccinated, while at lower risk, are getting infected. So it's really good to see the testing is increasing. Last week, 3.8% of the population got tested. That's good. Get tested if you have symptoms. There's much more availability of testing throughout the county. And it's brought our percent positivity down a little bit. Continue to slowly see gains in vaccinations. 65% of the total population, 76% of those eligible are vaccinated, but we've still got more to go to really cut down on this spread. One thing that I wanted to highlight is that we've looked at our data over the summer since we've had the Delta surge, and we wanted to see the effectiveness of the vaccine in Anne Arundel County during this surge. So we looked at cases and hospitalizations during a 3-month period from June 1st to September 4th, and we compared the case rate for people who are vaccinated against the case rate for those who are not fully vaccinated. And what we saw was that on July 15th, the case rate for people who were fully vaccinated was 1.2. For those who were not, it was 6.1. And by the end of August, that gap had grown significantly. We saw that the case rate for the vaccinated was 14.7, while for the unvaccinated, it was up to 49.6. And this is compared to a case rate of 19 for the county as a whole. So we're seeing that at the peak, there's a 3 times higher case rate for the unvaccinated compared to the vaccinated. We then did that same analysis to look at hospitalizations. Once again, comparing the hospitalization rate for those who are vaccinated against the hospitalization rate for those who are not vaccinated. We saw the 7-day hospitalization rate for the vaccinated group peak at 0.94 per 100,000 people, and it's now below 0.5. For the unvaccinated, the rate has generally been about 2 per 100,000 for the past month and a half. That's a 3 to 4 times higher risk of being hospitalized if you're unvaccinated compared to the vaccinated. That's in our county. And then at the national level, the CDC finds that the unvaccinated are 11 times more likely to die of COVID than those who are vaccinated. We also took a deeper dive on the data looking at children, and we looked at children over just a slightly longer time period from June 1st to September 22nd. And we saw that 11 children who were 0 to 9 were hospitalized during that time period, and 9, 10 to 19-year-olds were hospitalized. Now, not all of those children were eligible for vaccination. So 13 of them were 11 and younger who were hospitalized, 13 out of those 20. 7 out of the 20 were 12 to 19. And of that group, only 1 was vaccinated. The other 6 were not vaccinated. And during this time, we saw our vaccination rate in this age group go up from the 40s to over 70% now. The children being hospitalized, a majority of them, the vast majority of them, are not vaccinated, despite the fact that they're only a minority of the children, because most kids have gotten vaccinated. The bottom line is that if you haven't gotten vaccinated yet, it is really time to get the COVID vaccine. It is safe, it is free, but much more importantly, it is extremely effective. And we are seeing that in our county, and we have that data. It's available for everybody who is 12 and older. COVID is a vaccine-preventable death, and it greatly reduces hospitalizations. But I think it's also important to remember, particularly for kids, that parents don't worry about their kids getting diseases like measles or polio or diphtheria, precisely because we require vaccines for them for entry to school. But we can do the same for COVID. So given the effectiveness of preventing severe illness and death in children, we're bringing together a group to advise us on recommendations for vaccine requirements for school-aged children based on age groups, and we'll share more about that later this month. Lastly, a word on flu shots. They're now widely available. You can get them from the health department, from pharmacies, from primary care doctors, all the places that you got flu shots before. And the reason to get the flu vaccine is the same as it is for COVID, to prevent hospitalizations and death. You can protect yourself and your loved ones. Please get your flu vaccine as well. That I'll turn it back over to you, Jeff.
Thank you, Dr. Kalyana. First up on questions, and again, if you're a member of the media, please put your name and affiliation in the chat. I'll be calling on folks in that order. First up, John Frenet, Ion Annapolis.
I've got some questions for the county executive and also Bob Moser, if he is on the line. I'm not sure whether he is, but primarily on the school bus situations. And yesterday in your statement, Mr. County Executive, you suggested that somehow using federal money to make up the pay to the drivers with Annapolis Bus Company, which presumably would be the other contractors that are there. Are you concerned that where does this stop? How does the county inject tax dollars ultimately as a public entity into a private entity? Or did I misunderstand that statement entirely?
Yeah, no, we can absolutely do that. I mean, we've used our federal ARPA dollars to deal with the shortage of drivers with Public Works for trash pickup, and not through pay increases, but through transferring routes to new contractors to get the trash picked up. We contract with a lot of nonprofits to do a lot of the work using our federal money, and that goes into people's paychecks. So, and we can adjust those contracts if the pay needs to be adjusted in those. So, yes, it's possible to do that. The governor said the same, and whether it's done as an increase in the scale or whether it's done temporarily as a hiring and or retention bonus, the impact is the same. That's the contractors are the ones to listen to about what it takes to be able to hire and retain staff, and so it's certainly doable. In terms of long-term cost, yeah, there is a long-term cost to paying bus drivers a livable wage. And, as the leader of the county that provides most of the funding for our school system, I'm willing to say that we're committed to paying those higher wages, those livable wages, to get our kids to school in the future budgets.
Are you concerned about the sustainability on that? I mean, once the federal funds run out of the program, or we're out of COVID and everything else, I mean, we're looking at competition. We're hearing from Amazon and all these other transportation type entities. I mean, is ABC Company going to be able to go back to and to sustain whatever level we've obtained by the county?
I'm concerned about the sustainability of everything that government does, but I'm also concerned about the sustainability of our communities if we don't have a way to get kids to school. So some things you have to do.
Okay. Is Bob Moser on the line by chance?
Hey, John, I apologize. Bob is not on right now.
Okay. I don't know whether the county executive might know this, but you mentioned that they have 12-year contracts. I know that ABC had a 12-year contract with the school district. Typically with contracts, they are honored and paid. Do you know whether they were paid? I've heard that they were, but for the remainder of the 1920 school year, also the 2021 school year, which didn't exist as far as transportation goes for the most part. And obviously we're now into 21-22, because if they had, then the next question would be, are the drivers paid?
I'm told that yes, they were paid, and yes, drivers were paid, as were drivers employed by the school system itself and many other public employees that were laid off. There was some work that some of them were asked to do during COVID, but obviously less work when schools are closed.
So the drivers of these contractors presumably were paid for 15 months of non-work? I mean, maybe simplifying it, but.
Yeah, that's my understanding. I mean, I believe we would have a much larger driver shortage if they had all been laid off, and we had to go out and start from scratch, or the companies did.
Okay, my last real quick one and I will not monopolize anything more. The outdoor dining extension, you said to 2023, is that correct?
Early 2023, yes. So
that is an additional 2 months of what we already have plus a year.
Right.
Okay, and do you know whether Annapolis will follow that?
I do not know.
Okay, thank you. Sorry to hog.
Thanks, John. Next up, Brian Sears from the Daily Record.
Thanks, Jeff. I have two questions. First, for the county executive. Last week, the governor and the state health secretary announced that they were going to be expanding the use of the myir.net program to include the generation of a QR code that could be scanned by third-party entities, presumably businesses, local governments who want to check vaccination status. You mentioned that the county was exploring the idea of a third-party solution for a vaccine passport. Does the expansion of the myir.net get you there? And is the county still looking at moving to some kind of a voluntary third-party solution for this?
Don't we love that word, passport?
What would you like to call it, sir?
The governor was clear that what he was doing was not a passport. I'm not as afraid of that language. The bottom line is that it's a way to show whether you're vaccinated or not, and just the way you show whether you're a citizen of a country or not. But we are looking at that. The part that is the hardest to do is to have included in that app whether or not you've been tested recently and had a negative test. So we would the companies that we're talking to are offering that, and that's the question, is whether that added value is worth it. So we have not signed a contract with any of those companies that do those apps, but I believe it's a very positive development that they'll have a QR code, make it more simple with the MyIR.
And can you do this without the cooperation of the state health department if they don't allow the county or the third-party vendor to have access to Immunet?
No, the contractors have to have access to the state records. Otherwise, they couldn't do it. What they provide also is some of the protections against fraud, so that when you look at somebody's app that says that they're vaccinated, the company is ensuring that actually did come from the state of Maryland.
Thank you. And for Dr. K, a kind of a forward-looking question, because it sounds like as we stand today, the county's COVID numbers are looking a little better than we had perhaps earlier in the summer, although still worse than this time last year. IHME is projecting in Maryland that by Thanksgiving, we could see roughly 1,900 hospitalizations, including 400 ICU patients, and somewhere in the range of 4,700 to 9,800 cases per day, and that's in 9 weeks. I think the number that they're putting confidence in is roughly 6,700 cases per day on average. Given the staffing levels, the fact that we've seen one medical center in Anne Arundel County temporarily put off some surgeries, is there a concern that these numbers, which would look a lot like January rather than last November, will cause problems for medical care in Anne Arundel County? And what is there a solution?
Yeah, so we're keeping our eye on projections. IHME is one of them. We're looking at some CDC consensus projections as well, and there's a pretty wide range of possibilities, from seeing a steep increase to seeing level to seeing a decrease in hospitalizations. I think that points to what's really going to be happening over this cold and flu season. We're looking to the next 6 months to help determine what our new equilibrium is with vaccines and what COVID looks like during cold and flu season. To that end, though, that's why vaccinations are even that much more important, right? It is the thing that is keeping people out of the hospitals. When you look at our county and our state compared to other states in the country that have lower vaccination rates, those are the hospital systems that are getting slammed and that are being overwhelmed, and we're hearing the horror stories from. We're not going to be in that position, but we also don't want to stress our hospitals. As you noted, Anne Arundel Medical Center was stressed a few weeks ago. And so we're looking at staffing levels, we're looking at continued vaccination. And I think the most important thing is thinking about these kinds of programs as that businesses can do around vaccination or testing requirements for both staff and for people patronizing higher risk activities, we all have an obligation to reduce this spread, whether that's through vaccination or frequent testing. And so we're going to continue to push on that throughout the winter time.
Thank you, Dr. K. Next up, Amy Simpson, Fox 45.
Good morning. Question for the county executive. I had called the Annapolis Bus Company about an hour ago, asked to speak with management, and I was told they were in a meeting with the county. I'm wondering, sir, if you were a part of that conversation this morning.
No, I assume they meant county public schools.
Okay. And so do you have any insight into why the district does not directly employ bus drivers, why they choose to go through contractors?
I mean, that was a decision made years ago no, I wasn't a party to that decision. And I assume that like most contracting, it's an effort to save money.
Understood. And your message to families who are caught in the middle of, this driver shortage, driver strike right now. Parents have, burdened so much over the last 18 months with young children.
That's why I'm angry is that this is a fundamental obligation of our school system to provide transportation, and we're failing, which means that it's up to each family to figure out how to get their kids to school, whether it's carpool or whether it's getting to work, working different hours, or whether it's being put in a position where you end up losing your job completely. And that's happened as a result of COVID and kids not being in school already. Parents are trying to get back to work, get their lives back to normal. And this is something that we can fix. It will take some time to fix, but that's why I'm calling on Anne Arundel County Public Schools to deliver us a plan with a price tag to increase the pay, to incentivize this work, to get people back into this workforce so that we can save this industry and continue to get kids to school.
Appreciate it. And how many drivers have you heard from ahead of this roundtable on Thursday?
I have not got a number on that. Yeah.
But you have heard from some?
Yeah.
Great. Thanks so much.
All right, thanks, everyone. That's a wrap on this week. We'll see you back next time. Thank you.